distinguished senior colleagues, teachers. It's really an honor to be here talking and sharing this platform with esteemed personalities. Thank you. I wish to join my other colleagues in thanking Professor Tomori for giving us this insight. It's quite a great one. And I will be looking at what to add to it in 5 minutes, as I've been told, in perspective of Oyo State. I'll begin with the issues pertaining to the testings that had been seriously addressed. The testing matters started with a lot of stigma in the portion of the healthcare workers, the providers themselves, and as well as the public. And as we were moving along, this issue of stigma was dropping. And right now, unfortunately, because of the poor intervention in terms of media coverage, a lot of people are no longer taking the threat of COVID-19 as something to concern themselves about. You would agree with me that you could go around the streets of Ibadan, or even perhaps by extension of your state, and quite a number of people are there without face mask. I've had to remove mine because I had to speak on this channel. And to go further, the state went on a community drive to test people. We had about 12 community testing levels across the state, and that gave us the high numbers. We had a drive-through testing area that was set up within Ibadan, which gave the liberty for people that either to would just pass by, wouldn't want to show up their faces, to drive in, have their test done within 5 minutes and leave. And all those things culminated in the high numbers that we saw. And because of that, we felt that we could not continue having an ad hoc arrangement. Needs are that we should transit to a much more routine testing platform. And that is why the state had looked towards going to the general hospitals. And as we speak, the general hospitals have been highlighted by the last speaker. And unfortunately now, we're not having that much testing going on, maybe as a result of the misinformation that is there in the media. And people are no longer seeing it as a public health issue. And that perception is actually leading to the poor reduction in the numbers that we're seeing at this point in time. The third issue with the issue of testing is the personnel themselves. We've had so many of our personnel coming down with the COVID illness, as it were. I recall the instance when we had a training for lab scientists all across the state, and we had to test those lab scientists so that it would be part of what they would be doing. And we found that we had about 20% positivity amongst them, which actually gave a really difficult thing to swallow. And that is, as we saw at that time, and those challenges are still what we are still seeing. We've had virtually all forms of healthcare service points across the state that are having personnel falling ill with the disease. On the second note, the issue of data. I'm glad that that had been thoroughly dealt with, but I was glad that Professor Tomori mentioned the fact that we're having the poor issues with data. The platform that is being used is called Summers, and Summers is at the behest of the NCDC. Even the state has issues utilizing the platform to recall data and utilize it for needs. And as it were, it also gives room for the time lag for reporting. and that leads to a lot of backlog in the results that we see. Professor Oshungbade had actually showed the deaths, and we have a state that is recording deaths over a whole month, and that is the challenges that we are seeing with the summers. Another one is the issue of the public or political will. I smiled when I saw the slide talking about the curfew. Quite a number of people in high places are putting pressure on the fact that is there a need for us to be having a curfew when apparently there is not so much of people that are coming ill with the disease, and because of that, that is perhaps what has culminated in what we've seen. And unfortunately, in Oyo State, what data we have actually shows that a lot of our cases are more inclined to those that are restricted to transmission within closed areas. And unfortunately, those are the places that are still open after the curfew had been removed. So those are things that are the impediments towards the goal that we set to achieve. And lastly, talking about the possibilities for larger numbers, we are looking towards having resumption of institutions, especially our tertiary institutions. A lot of the students are going to go across state boundaries. Some states have not been doing too well in terms of testing, and that does not say that the COVID virus is not going through serious transmission there, and they are going to come into our institutions here. More importantly, we need to also give into serious thoughts as lecturers in the universities, SARS and MAS. A lot of our classrooms have very high number of students that sit within a same choky environment, and that is a major concern towards transmission when schools reopen. And I think that is something that needs to be given some serious thoughts about. To me, it's a much more difficult issue to contend with than the international travels. The international travels, yes, we might be saddled with some, yes, we might be having some issues with some other strains of the virus coming into the country. But for now, those are the thoughts and those are the issues about the misscience of the COVID response as we have in Oyo State. I thank you so much for being part of this. I am really